A very good morning to everyone gathered here. It is my privilege to extend a warm welcome to all the distinguished dignitaries, esteemed speakers, respected faculty members, delegates, and the participants here today for the two-day International Conference on Health Humanities titled Ethics, Values, and Human Dignity, Psychological, Literary, Artistic, and Medical Perspectives, jointly organized by the Departments of Psychology and English of DCT's Dempe College of Arts and Science in collaboration with Sangat and Manipal Hospital, Goa. It is indeed a pleasure to have amongst us the chief guest and keynote speaker, Professor Vikram Patel, Paul Farmer Professor and Chair of the Global Health and Social Medicine at Harvard Medical School. Guest of honor, Director, Manipal Hospital, Goa, Shri Surendra Prasad. Administrator, Dempo Charities Educational Institutions, Shri Rajesh Batikar. Trustee, Madam Pallavi Dempo. And Principal of DCT's Dempe College, Professor Dr. P.S. Ramamurthy. It gives me immense pleasure to acknowledge the presence of our plenary speakers and distinguished panelists, Vice Principal Dr. Swati Pawar, Event Coordinator and In Charge Department of English, Ms. Clarinda Dias, and all the heads of the Department of Dempe College present here. It is my privilege to welcome you all to this occasion. We are honored and delighted to have with us today a distinguished gathering of scholars, practitioners, researchers, faculty, and students from across the country and beyond. Your presence lends this occasion purpose, and we are immensely grateful for it. To begin this auspicious occasion on a serene and spiritual note, I request our students, Atharva, Shreya, and Vishant, to lead us into Ganesh Vandana, to seek the blessings for a purposeful and enlightening conference ahead. Thank you, students, for that soulful invocation. May I now request convener Dr. Mukta Karmadi and co-convener Dr. Akshata Bhatt to kindly escort our dignitaries to the dais. Thank you, ma'am. We are indeed fortunate to be in the presence of an eminent personality, Professor Vikram Patel, the chief guest for today's function and the keynote speaker. Professor Patel is Paul Farmer Professor and Chair of Global Health and Social Medicine in Blavatnik Institute's Department of Global Health and Social Medicine at Harvard Medical School. He co-leads the department's Mental Health for All Lab and co-leads the Global Mental Health at Harvard Initiative. His work has extensively focused on the burden of mental health problems across the life course, the association with social disadvantage, and the use of community resources for their prevention and treatment. He's a co-founder of the Movement for Global Mental Health, the Center for Global Mental Health at London School of Hygiene and Tropical Medicine, the Mental Health Innovations Network, and Sangat, an Indian NGO which won the WHO Public Health Champion of India Prize and the MacArthur Foundation's International Prize. Professor Patel is also a fellow of the UK's Academy of Medical Sciences and member of the US National Academy of Medicine. He served on the committee which drafted India's first national mental health policy and the WHO High-Level Independent Commission for Non-Communicable Diseases. He co-led the Lancet Commission on Global Mental Health and Sustainable Development and the Lancet World Psychiatric Association Commission on Depression. He serves as the co-chair of the Lancet Citizens Commission on Reimagining India's Health System. Professor Patel has been awarded the Karmers Medal, Royal Society of Tropical Medicine and Hygiene, the Sarnet Prize, National Academy of Medicine, the Path Humanitarian Prize, the Brain and Behavior Research Foundation, the Clermont Senior Investigator Prize, the Depression and Bipolar Disorder Alliance, an honorary OB by the UK government, and John Dirk Canada Gairdner Award in Global Health. He has been awarded honorary doctorates from Georgetown University, York University, Stellenbosch University, and the University of Amsterdam. He was listed in the Time magazine's 100 Most Influential Persons of the Year in 2015. We truly welcome you, sir. I request Assistant Professor Dr. Shweta Matonkar to present a bouquet to our chief guest and keynote speaker, Professor Patel. Thank you, ma'am. We are indeed fortunate to have with us guest of honor, Director, Manipal Hospital, Goa, Sri Surendra Prasad. Under his vision, Manipal Hospital, Goa has been a front-runner in providing accessible and quality healthcare while actively fostering an ecosystem of care for all. Mr. Prasad brings a wealth of expertise in healthcare leadership with a focus on strengthening infrastructure and advancing specialized care. His vision for regional medical interventions aimed to transform healthcare accessibility in Goa and beyond. A champion of innovation, Mr. Prasad has spearheaded initiatives in advancing the scope of healthcare. His leadership is marked by a commitment to excellence in healthcare delivery. We welcome you, sir. I request Assistant Professor Pratisha Harmalkar to present a bouquet to our guest of honor, Shri Prasad. Thank you, ma'am. As a gesture of our respect and gratitude, we would now like to present a floral welcome to all our dignitaries. I request Assistant Professor Dr. Shweta Matonkar to present a bouquet to our Chairman, Dempo Charities Trust, Sri Srinivas Dempo. I request Shweta Matonkar ma'am to present a bouquet to our trustee, Madam Pallavi Dempo. I request Assistant Professor Pratisha Harmalkar to present a bouquet to our administrator. I request Assistant Professor Dr. Shweta Matonkar to present a bouquet to our principal, Professor Murthy sir. Thank you all. I request our principal, Professor Dr. P.S. Ramamurthy, to kindly address the august gathering and extend a cordial welcome to our distinguished guests.
Thank you so much, Isha. Good morning and a very warm welcome to everyone present out here. Respected Chief Guest and Keynote Speaker, Professor Vikram Patel, Paul Farmer Professor and Chair of Global Health and Social Medicine, Harvard Medical School. Guest of Honor, Mr. Surendra Prasad, Director, Manipal Hospital, Goa. Our Trustee, Srimati Pallavi Dempo, Dempo Charities Trust. Our Administrator, Sri Rajesh Batikar. My Vice Principal, Dr. Swati Pawar. Our patrons and dignitaries, esteemed plenary and panel speakers, distinguished delegates and dignitaries, faculty members, and my dear students. Welcome to the two-day International Conference on Ethics, Values, and Human Dignity in Healthcare, Psychological, Literary, Artistic, and Medical Perspectives, organized by the Departments of Psychology and English, DCT's Dempe College of Arts and Science, in collaboration with Sangat Goa and Manipal Hospital, Goa. It gives me immense pleasure as the principal of DCT's Dempe College of Arts and Science to welcome all of you to this meaningful gathering this morning. A special welcome to our plenary speakers, Professor Richard Wellman, Emeritus Professor, University of Bath, Professor Abhijit Nadkarni, NHR, Professor of Global Health Research, London School of Hygiene and Tropical Medicine, Dr. Kaveri Nambisan, noted surgeon and novelist, Dr. Shiv Shankar, Professor and Head, Department of Medicine, Kasturba Medical College, Manipal, Professor Gayatri Prabhu, Professor and in charge, Director, Manipal Institute of Social Sciences, Humanities and Arts, and Professor Nikhil Govind, Professor, Manipal Institute of Social Sciences, Humanities and Arts. We are equally honored to welcome our panelist, Dr. Mahadeva Swami, hemato-oncologist and lead consultant, Manipal Hospital, Goa, Dr. Ashwini NV, psychologist, founder director, Mukta Foundation, Bengaluru, Dr. Amit Dias, lecturer, Department of Community Medicine, Goa Medical College, and Dr. Anjali Chaube, assistant professor, Shenoy Gombap, School of Languages and Literature, Goa University. A warm welcome to all our collaborators as well, Sangat Goa and Manipal Hospital, Goa, and to all the participants from healthcare, education, community, organizations, and NGOs who have joined us today to share their research, reflections, field experiences, and creative work over the next 2 days. This conference is distinctive, not only in its theme, but in its approach. It brings together psychological, literary, artistic, and medical perspectives to reflect on the human being at the center of care. The person's story, agency, vulnerability, and dignity in the broad framework of health humanities. We are reminded that healthcare is not merely an interaction of symptoms and solutions. It is also an encounter with meaning, emotion, ethics, culture, communication, and compassion too. This conference highlights that health humanities emerges at the crucial intersection of medical science and the human story of suffering and healing, where psychological perspectives help us understand cognitive, emotional, and social dimensions of illness and care, and where literary and artistic perspectives foreground narrative, voice, memory, and meaning. This interdisciplinary platform invites not only empirical research, but also experience-based and reflective contributions, because the emphasis is on connecting health and humanity beyond data into stories that inspire understanding and change. At this juncture, permit me to also share a brief note of our institution, DCT's Dempe College of Arts and Science. DCT's Dempe College of Arts and Science, managed by the Dempo Charities Trust, was founded in 1962, 6 months after Goa's liberation, and stands as the oldest institution in the state of Goa. It was incepted by a group of educationists, industrialists, and philanthropists, prominent among them being the Dempo family, with a visionary outlook rooted in self-reliance, innovation, and inclusivity, determined that people of newly liberated Goa should not be deprived of higher learning. Under the able leadership of our dynamic chairman, Sri Srinivas Dempo, and trustee Madam Pallavi Dempo, the institution has consistently embraced new learning ecosystems, and today it stands as an alma mater to leaders across Goa, India, and abroad, working towards building a knowledge-driven society where scientific temper coexists with humane thought and responsible action. This conference is also an expression of the strengths and the values of our organizing departments. The Department of Psychology, through academic rigor, internships, and community engagement, advances empathy and inclusion, and in collaboration with Sangat Goa, has worked through initiatives such as Jagriti to promote mental health awareness and reduce stigma. The Department of English integrates critical thinking with contemporary and creative perspectives, engaging with areas such as healthcare, narration, and digital humanities, and encourages learners to explore how language, culture, and representation all share an experience of illness and care. Healthcare today sits at a crossroad. We are witnessing remarkable advances, yet we are also faced with profound ethical questions about equity, access, consent, compassion, the pressure on healthcare systems, the well-being of caregivers, and the dignity of patients and their families. Conversations on ethics and human dignity cannot remain within one discipline alone. They require the combined strength of medicine and mental health, literature and art, culture and policy, because these realities that we confront are multidimensional, and so must be our responses. We are therefore deeply honored to have Professor Vikram Patel with us as our chief guest and keynote speaker this morning. Sir, your pioneering work in global mental health and your lifelong commitment to making care accessible with human resonates powerfully with the very heart of this conference. Your presence here today will inspire both seasoned professionals and young learners to pursue healthcare and well-being with excellence and empathy. Thank you so much, sir, for having accepted our invitation to grace the occasion. I also express our heartfelt gratitude to our chairman in absentia today, Sri Srinivas Dempo. Unfortunately, he had a last-minute emergency to travel and couldn't be here. And our trustee, Madam Pallavi Dempo, for her gracious presence and constant encouragement to pursue initiatives that strengthen academic depth and our social responsibility. A special welcome to our administrator, Sri Rajesh Bhatikar, whose support and coordination play an important role in the smooth functioning of our institution and in the successful organization of events such as this. My sincere appreciation goes to the conference conveners, Dr. Mukta Karmadi and Dr. Akshata Bhatt, and every member of the organizing team for the thoughtful planning and the dedicated effort invested in making this conference possible today. To our delegates and participants, thank you for traveling, preparing your work, and bringing your insights to this platform. I encourage you to use these 2 days not only to present and listen, but also to connect across disciplines, across institutions, and across ways of seeing ahead. Let this conference be a space where ideas are sharpened, collaborations are born, and where we return to our work with renewed clarity and vigor, about what it means to honor ethics, values, and human dignity in healthcare. With these words, I once again extend a warm welcome to all of you today, and I wish everyone a truly enriching and memorable international conference. Thank you so much once again.
Thank you, sir, for your inspiring words of welcome and encouragement. I would like to invite the convener and the head of the Department of Psychology, Associate Professor Dr. Mukta Karamadi, to illuminate the thematic vision and intellectual spirit of the conference.
Thank you, Isha. Good morning to one and all. Dignitaries on the dais, Honorable Chief Guest, Professor Vikram Patel, Professor, Howard Medical School, esteemed guest of honor, Sri Surendra Prasad, Director, Manipal Hospital, our Madam Srimati Pallavi Dempo, Trustee, Dempo Charities Trust, Principal of DCT's Dempe College of Arts and Science, Professor P.S. Ramamurthy, our Administrator, Sir, Sri Rajesh Patikar, co-convener of the conference, Dr. Akshita Bhatt, dignitaries of the dais, distinguished plenary speakers, panelists, honorable delegates, researchers, faculty members, students, and media representatives. On behalf of DCT's Dempe College of Arts and Science and our collaborators, Sangat and Manipal, I extend a warm welcome to each one of you to this two-day international conference on ethics, values, human dignity in healthcare, psychological, literary, artistic, and medical perspectives. It's a matter of great honor for us to host this important academic gathering where scholars, practitioners from diverse disciplines have come together to have a discourse on one of the most important concerns, that is the place of ethics, values, and human dignity in healthcare. Healthcare today is witnessing extraordinary scientific advancement as well as technological advancement. Artificial intelligence, robotic surgery, genetic counseling, telemedicine, and data-driven diagnostics have revolutionized the way care is delivered. However, as systems become more efficient, technology-oriented, growing concern is that the human element of care is gradually overshadowed. The core question before us is not merely how advanced our healthcare systems are, but how humane they remain. This is where the field of health humanities becomes profoundly significant. The theme of this conference emphasizes that healthcare is not only a medical science, it's also a deeply human enterprise, rooted in moral responsibility, compassion, and respect for the dignity of every individual. This conference aims to facilitate cross-disciplinary conversations which can significantly shape ethical decision-making and care practices. From the psychological perspective, we explore how ethical sensitivity, trauma-informed care, and patient-centric approaches shape healing. From the literary and artistic perspectives, we understand how narratives, visual arts, storytelling give voice to suffering, resilience, and hope, human experiences that no clinical chart can capture. From the medical perspective, we confront ethical dilemmas in end-of-life care, informed consent, digital confidentiality, equitable access to healthcare services. Collectively, these perspectives demonstrate that healthcare must be understood as an integrative field in which ethical discernment, psychosocial insights, and cultural meaning are intertwined. It is within the domain of education, this interdisciplinary synthesis acquires a transformative potential. By engaging future doctors, nurses, and psychologists with literature, arts, and reflection on ethics, we move beyond technical instruction to foster practitioners who uphold human dignity at the core of healthcare. The conference is convened with the following objectives. Firstly, to foster interdisciplinary discourse on advancing ethics and human dignity in healthcare, to deliberate on the role of humanities in cultivating critical reflection and compassionate practice among health professionals, to emphasize upon the role of socially grounded and economically viable community-based interventions in enhancing inclusivity and accessibility to healthcare. Lastly, to create a repository of ideas which can serve as a metadata for policy assessment. We are very delighted to have an overwhelming response to this conference. We have received 85 research papers for presentation at this conference. And now I would like to share the outline of this two-day conference with you all. Following this inaugural function, we initiate the conference proceedings with a keynote address by Professor Vikram Patel. The deliberations subsequently will proceed with plenary sessions by Dr. Shiv Shankar, Professor Gayatri Prabhu, and Dr. Nikhil Govind. Post-lunch, we'll host a panel discussion on the theme, Challenges in Healthcare, a dialogue between providers and receivers. The panelists are Dr. Mahadev Swami, Dr. Amit Das, Dr. Ashwini Envi, and Dr. Anjali Chaubey. The proceedings for the day culminate in 4 parallel papers presentation sessions. The second day commences with the invited international speakers, Ms. Anu Benekatti, Dr. David Keir, Ms. Melissa Follis, discussing community care in advanced settings. The day proceeds with the plenary sessions by Dr. Richard Wellman, Dr. Kaveri Nambisan, Dr. Abhijit Nadkani. The afternoon segment is dedicated to paper presentations again. And we conclude the conference with a valedictory function, marking a moment of reflection and collective commitment to the values that we have explored. May these 2 days inspire us to look beyond protocols and policies and place human dignity at the heart of healthcare. I once again extend a warm welcome to each one of you. Thank you so much.
Thank you, ma'am. It is a mark of our undying tradition to invoke the blessings of the Almighty by kindling the lamp of knowledge and wisdom. I request our esteemed dignitaries to light the traditional lamp.
शुभं कुरुध्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुध्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरुध्वं कल्याणम् आरोग्यं धनसम्पदः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम्
Thank you all. May this light guide our deliberations towards wisdom and compassionate understanding. We now move to an important milestone of this conference, the release of the abstract book. This volume is a testament to the intellectual endeavor representing the collective scholarly contribution of all the participants. I would like to request the dignitaries to kindly release the abstract book. Thank you all. We congratulate all the contributing scholars whose work enriches this volume. I request the trustee of Dempo Charities Trust, Madam Pallavi Dempo, to deliver her address.
Dignitaries on the dais, our chief guest and our keynote speaker of today, Professor Vikram Patel. Guest of honor, Shri Suren Prasad, Director of Manipal Hospital, Goa. Principal of Dempe College, Professor Ramamurthy. Administrator of Dempo Charities Trust, Shri Rajesh Bhatikar. Our convener of today's conference, Dr. Mukta. Our co-convener, Dr. Akshada Bhatt. Respected members from the audience, research scholars, our faculty members, all administrative staff, research scholars from India and abroad, and dear ladies and gentlemen. A very good morning to everyone, and my warmest greetings to each and every one of you all. In fact, as Principal has mentioned, the Dempe College was the first college in Goa, which was established in 1962. And it was the first college to be set up post-liberation. And we're extremely proud of all the stakeholders of our college. I mean, be it the past principals, the present principals, all our faculty members, all our students. In fact, as a trustee, I always feel and I always appreciate the fact that the Dempe College has done significant strides of progress. I mean, be it academic performance, be it the NRF ranking, our, in fact, also with all our certifications and our NAC accreditation as well. Overall, for the Dempe College, the current year reflects a year of strong institutional consolidation, measurable progress on quality benchmarks and national recognition. Major capacity building through our DBT STAR scheme, our strengthened research funding and outputs, and a highly successful internship model with full student participation, wide-ranging MOUs and partnerships, and sustained excellence in academic events and community engagement. In keeping with this tradition, this conference too is being organized by departments which have been extremely proactive. I mean, both our departments have been very, very active, both our psychology department and our English department as well. The Department of Psychology under the flagship mental health program Jagriti, in which we have collaborated extensively with Sangat. In fact, I was just mentioning to our good friend, Professor Vikram Patel, that we have had an extremely long association with Sangat. The Department of English has been driving innovation in the fields of language and translation. Over the years, both the departments have been awarded project grants on areas of social and community relevance. And the noteworthy fact is that students are being trained and given leadership roles in both, ensuring that a future generation sets its priorities in the right direction. As I think all of us know here, Sangat and Manipal Hospital, both of them have been at the helm of holistic healthcare in India. And it's a matter of great pride that we have had a very long association with Sangat, as part of which several mental health related programs have been organized. We're extremely happy to have with us our chief guest and our keynote speaker of today, Professor Vikram Patel, who I have extreme high regards for. His exemplary work in mental health has been vital in strengthening community-based responses to prevention and care, and we really, really look forward to his keynote address. Our collaboration with Shri Suren Prasad, thank you so much for your support for this initiative. And thanks so much for being with us here today. In fact, we're extremely happy to know that there have almost been 85 paper presentations, which is going to be, there for the conference. We have had an amazing response. Thanks so much to all of you all for being here. And I'm sure, this entire this conference would actually help us with a very deep understanding and, of course, inspire action. And all the very best for a very successful conference today. Thank you so much. Thank you.
Thank you, ma'am, for your thoughtful and enriching words. I would now like to request the chief guest for the function, Professor Vikram Patel, to address the august gathering.
Thank you very much. Just so you're forewarned, I'm also speaking again, so I'm going to be keeping my remarks very brief in this opening inaugural session. I wanted to, first of all, of course, thank the organizers for the honor and privilege of being a chief guest at this function. The theme is, I think, one of the most important subjects that affects each and every one of us every day of our lives, not only because we're concerned about our own health, and certainly at my age, even more so, but also the health of our family members, the people we love, and indeed, I would hope, even the people we don't know in our communities. But I'm going to be speaking more about that in the next lecture. Instead, what I really want to do today in these few moments is to express my deep gratitude for the college's vision of establishing partnerships. It's not very common, to be quite honest, to see in India partnerships of this kind, where a college, an incredibly historic college, forms a partnership with a private hospital and a NGO to jointly organize an international conference. And for this, I have to commend whoever in the college's leadership thought about these partnerships. Because in my mind, the only way you can really seek progress in an inclusive way is through partnerships. Partnerships between different sectors in our country that are each playing a critical role in our development. The private sector, civil society, and the educational sector. Only together can we make a strong and resilient country. And I will again speak more to that in the context of healthcare in my next remark. I want to actually speak about why, for me, this is a very special moment. My colleague, Aresh Nayak, who's the chairperson of Sangat, is also here today, and I want to acknowledge him. Because actually, Sangat has grown as a Goan organization with global impact, thanks, in fact, to partnerships. Those partnerships have involved many different agencies, but I want to single out, since we are here at this particular function, the Dempo Charities. I remember very well, we founded Sangat in 1996. I remember very well in the late 90s, it was maybe 2 or 3 years after Sangat began, we were a very small NGO operating out of a 1-bedroom rented apartment in Polvuri. Mr. Srinivas Dempo invited me, and he invited me, which I thought itself, given we were an unknown NGO at the time, for a meeting at his office, at which time I also met who was to be the future Chief Minister of Goa, Sri Pramod Sawant. We were together in this room in his office overlooking the Mandavi River, and he said that the Dempo's charities had identified 4 or 5 NGOs to work in the mining areas of Goa. And Sri Sawant had an NGO called SciLife, which was working on HIV/AIDS prevention, and Sangat was working on particularly school mental health. It's a real pleasure to tell you, Madam Dempo, that work that began in the late 1990s, we were working in 7 schools in Sattari and Bicholi talukas. That work led to the design of a health promotion intervention for school children, which then went from Goa to Bihar, where we ran one of the largest studies ever conducted with the government of Bihar's Department of Education as a partner. And that intervention now has become part of the Goa counseling program, which has been scaled up right through the state of Goa. But very importantly, that very intervention is now being adapted and implemented in places as far away from India as Japan and Brazil. And for me, this is a lesson of how investments that charities like yours make in small, we were very small then, civil society organizations in innovations can actually have not just local impact, but global impact. And so I want to thank the Dempo Charities, and I also want to thank, on behalf of Sangat especially, this college for the wonderful partnership that you have established with us. It's something that I personally cherish and very much look forward to when I retire from Harvard Medical School to spend even more time with working with all of my friends and partners in Goa. Thank you.
Thank you, sir, for your insightful address. In recognition for their distinguished presence and invaluable contribution to this conference, I request Madam Pallavi Dempo to present a memento and a citation of honor as a token of our deepest appreciation and respect to our chief guest, Professor Patel. In recognition of the distinguished presence and invaluable contribution to this conference, I request Principal Sir to present a memento and a citation of honor as a token of our deepest appreciation and respect to our guest of honor, Sri Surendra Prasad. Thank you all. As we draw towards the close of this inspiring gathering, I request the co-convener, Assistant Professor Dr. Akshata Bhatt, to propose the vote of thanks.
Thank you, Isha. Esteemed dignitaries on the dais, luminaries in the audience, delegates, dear colleagues, as we come to the close of this inaugural ceremony, it is my honor to propose the vote of thanks on behalf of the organizing team. In many profound ways, the very ethos of this conference has been deeply inspired by the scholarship of Professor Vikram Patel and his transformational work in healthcare. So you can just imagine our happiness when he consented to be the keynote speaker here. We are deeply grateful to you, sir, for your presence as chief guest and for your consent to deliver the keynote address. We also take this opportunity to acknowledge our long-standing association with Sangat, as the other dignitaries have also mentioned, which has immensely shaped, in fact, our outreach activities, especially in mental health awareness. Our sincere appreciation to our guest of honor, Sri Surendra Prasad, for his distinguished presence and for the incredible support extended by Manipal Hospital, Goa for this event. In fact, sir, your support strengthened our initiative and helped us take it in the right direction and scale it up. We are tremendously grateful to our visionary management. In fact, I take this opportunity to place on record our gratitude to Madam Pallavi Dempo, who has been at the forefront of expanding academic horizons and encouraging us as well to take new directions in research. Madam, you bring a sense of perfection to every event we pursue, and it helps us strive for the better of the event as well. Our special thanks to the administrator, whose support has been instrumental in the ideation and planning of this conference. We at the college are privy to the nuanced insights he provides in every event, and we are grateful for that. To our principal, sir, thank you for creating an ecosystem where new ideas are allowed to flourish. If not for your guidance, we don't think we could have even accomplished this pursuit. Thanks to our Vice Principal, Dr. Swati Pawar, for her strategic guidance through the process of planning as well. To our plenary speakers and panelists who have traveled from far and near to lend their expertise in these vital discussions, a heartfelt thank you to each and every one of you. To Isha Palkar for leading us to the ceremony, to students who presented the invocation, representatives from media houses for their presence at this ceremony, deep gratitude. Finally, there is a quote at the back of our abstract book, some of you will be able to see it later, which says, "Where the art of medicine is loved, there is also a love of humanity." Dear audience members, representatives from nodal research bodies of Goa, HODs, delegates, and participants, I believe that your presence here is truly the embodiment of this sentiment. Thank you very much.
Thank you, ma'am. We sincerely hope this conference fosters meaningful dialogue, interdisciplinary learning, and deeper understanding of ethics, empathy, and human dignity in healthcare. Thank you all for your gracious presence. We will begin with the keynote address shortly, wishing each one of you a productive and enriching conference ahead.